Hello, I'm El-Chammas, a second-year fellow in Pediatric gastroenterology at the Children's Hospital of Wisconsin. For my fellowship research project, I wanted to evaluate the role of high-resolution manometry, also known as HRM, to study colon motility in pediatric patients. HRM was initially introduced to evaluate esophageal motility. With HRM, the pressure sensors are placed close together, and the data is displayed using pressure topography plots, so it gives more detail. This has improved the ability to diagnose esophageal motor disorders. We were interested in evaluating the ability to recognize high-amplitude propagating contractions, also known as HAPCs, as well as gastrocolic response in pediatric colon motility studies using HRM. We used a custom-made colon manometry catheter with 36 pressure sensors. The proximal 20 sensors were spaced 4 cm apart, while the distal 16 were spaced 2 cm apart. The data obtained using HRM was converted into pressure topography plots using software provided by medical measurement systems. As shown here, the high amplitude propagating contraction, also known as HAPC, is identified on the more conventional water-perfused colon manometry. When converted to HRM mode, the HAPC is also recognized. For each of 10 patients, the same data was displayed as conventional manometry and high-resolution manometry. The studies were anonymized, and 2 gastroenterologists who were blinded to the patient information evaluated the studies independently. We calculated the kappa value and percent agreement using SPSS software. There was very good agreement when using HRM compared to conventional manometry to analyze the motility studies for both observers. In addition, there was very good agreement between the observers when using HRM or conventional manometry to analyze the studies. In a few instances, there were low kappa values despite a good percentage agreement, and this was attributed to a statistical imbalance in the margins. We also compared 30 HRM to 20 water-perfused colon manometry studies. We noted no significant difference in the median time for fluoroscopy or in the number of complications such as catheter coiling between the 2 study types. We did note the ability to recognize rectal propagating contractions and to evaluate anal pressures during HRM studies. During HRM studies, we recorded propagating rectal contractions with defecation. This has not yet been demonstrated manometrically. We were also able to evaluate the anal pressure profiles in several subjects. For example, in 6 patients, the anal pressure decreased with defecation, while in 1 patient, the anal pressure increased with associated abdominal pain. This study showed that it is possible to recognize HAPCs and gastrocolic responses using HRM. In addition, HRM may provide information regarding rectal motility and anal pressure changes during colon manometry recording. We found a good agreement between the 2 observers when analyzing manometry with HRM and conventional manometry. Please do not hesitate to contact us for further information about the study. Thank you.